I am pleased to introduce our speaker for this evening. Next slide. Laura Gibofsky is a senior dietitian at Hospital for Special Surgery, where she specializes in delivering nutrition care for rheumatic and orthopedic conditions. Laura received her undergraduate degree in dietetics from the University of Wisconsin-Madison and a master's degree in public health nutrition with a concentration in maternal and childhood nutrition from Case Western University. Laura has authored numerous nutrition-related articles and lectures on a variety of topics, including managing inflammatory conditions with diet, bone health, and weight management, and has been cited in a variety of print and digital sources. Her professional focus is helping patients achieve their goals by promoting healthy, nutritious, and balanced food choices in a realistic and achievable way. And with that, I am so pleased to introduce Laura this evening. And Laura, I'll let you take it from here.
Thank you, Claudia, and hi, everybody. I'm so honored that all of you have decided to share your evenings with me, and not just some of you, but a large group of you. So I hope that I know that you're all engaged in this topic, so hopefully we can all learn something together here tonight. I know I do look forward to the Q&A section, so I promise to leave some time at the end because I always really learn a lot, and I like to be challenged, and these are always the toughest questions, and so hopefully we can all get through them. So tonight I'm going to talk a little bit about nutrition and osteoarthritis. And I always like to just start out by saying we are in an era where everybody can get information at their fingertips. So I'm really excited that you're here listening through HSS, through a reputable source, because there's a lot of people out there who are touting to be experts. So I'm really excited that I'm able to share my expertise with you tonight. And so with that, hopefully we can learn something. I know that hopefully everybody's looking for some magic pill or something like that that's sold online. I'm not going to be able to provide that for you tonight, but I'm hoping that I can give you some tips and tricks and things that I do daily and try to teach with my patients to help improve their life and learn a little bit something together. So let's get started. So just a little bit of background on osteoarthritis. It is the most common form of arthritis, and it affects joints like the knees, hips, hands, and spines. And again, it's caused by wear and tear of the cartilage. And so symptoms, and I'm guessing that many of you may have these symptoms, so you can probably speak better to this than I can, but joint pain, stiffness, and really reduced mobility, and probably some changes in what you're experiencing in your everyday life and activities. So risk factors, obviously aging, and I didn't say old, I said aging because I'm very specific to that myself. When people say that, we're just getting older, but we're not old. Joint injury or overuse is a big one. Also, obesity is a huge concern. So we will talk about some ideas about making sure that we're keeping a healthy weight. And then obviously genetics does play a component. So I do also want to point out that there are no foods that cause OA. And with that, there are also no foods that can cure it. But following a well-balanced diet can alleviate symptoms of the disease. And by that, I want to make sure that we're helping to reduce inflammation all over, that we're going to maintain strong bones and muscles. And as I mentioned before, we're going to achieve or maintain a healthy weight lifelong because it's going to help reduce on the joints. So people with OA should eat a well-balanced diet that includes plenty of fruits, vegetables, and whole grains. It should also include moderate amounts of meats, poultry, and oily fish. And we'll get into this a little bit more into the nitty-gritty because there is some exciting research about different ways of how you can incorporate this. But I just want to emphasize that, again, good nutrition is an important part of an overall treatment plan of the disease. So what's so special about HSS is that we're an interdisciplinary hospital and everybody brings their focus. And so it's not a replacement for one part, but it's a great way to include it as part of a treatment plan. I like to start off with this slide in pretty much all of the talks that I give because I just think it's important to kind of look at where we are as the United States population, what we should be eating, and how we are definitely not eating anywhere near that. So if we look at this graph, it actually shows that more than 80% of us have dietary patterns that are low in pretty much all of the things that I just talked about. So we're talking total vegetables. And as you can see, we are well below the line. It's hard to even find something where we're above the line. Oh, wait, the areas that we're above the line include refined grains. Usually also, like, we're pretty good at eating animal products and meats, poultry, and eggs. But where we're lacking, if you look in our first box from total vegetables, I would like to say that's from the dietitian's point of view. We really need to improve that. And so if there's one thing that hopefully we can all do after tonight is get more vegetables, and fruit into our diet. So I do want to talk off, obviously kick it off a little bit about bone health, because these are the obvious ones that we think of with that. But obviously calcium and vitamin D are so important to maintaining our bone health. And so dairy products such as low fat and non-fat milk, yogurt and cheese, also canned sardines, one of nature's bounty, an excellent thing, something that I've had to really force myself to include into my diet because it's not the easiest thing. So as a dietitian, I'm at least honest about it. It wasn't something that was easy, but if I'm going to put it on a slide, I got to make sure that I'm trying it. And sometimes if you think about the powerful, how one thing of food can really provide so much nutrients, can change your way about how you want to include it. Also our vitamin D, and again, you can look at this and use it as a reference. And I also will point out that, again, I understand that some people may not include dairy in their diet for whatever reason. And so fortified foods is another great way, and you will get some calcium from your leafy greens as well. And then it's something that you may want to talk to your doctor about if you are not doing that, and ways about maybe including a calcium or possibly even a vitamin D supplement. So as far as fats in our diet, we look at it as I don't like to say never, because again, I'm not a restrictive in that sense. I think that everything in moderation in our diets, but we have our bad fats that we really don't want to include. There's nothing beneficial to them. And then we have our better fats. So remember, better fats in the sense that they are better than the other ones, but still with that, it's not something that we want to eat unlimited amounts of in our diet. But we do want to have more of those fats in our diet compared to the other ones. So when we think of these bad fats, these are really our animal products, our fatty cuts of meat, our poultry with the skin, dairy products, butter and lard and sauces and gravies. I shouldn't be making that face because these are delicious foods, and I will admit I do eat them. So I don't want you to think that I'm above all or anything like that. That's not how I approach nutrition. And also things like coconut oil, palm kernel oil, margarine, and some vegetable oils. So again, these are types of fats that we just really want to try to limit our total overall intake. Then we have these better fats, and there's a lot of research out there why they are better. And so these are our unsaturated fats, and they have been associated with lower inflammation, and these are predominantly found in our plant-based foods. And so we can get them from olives, canola oil, soybean, corn. I know that there's some out there right now with seed oils and things like that. So again, I'm not going to go into that specifically, but there are lots of different types of oils, but there's a whole different variety of them. So whatever works best for your diet and what you're following. We also are going to find them in our nuts, which is why nuts, I always tell people, they can be packed with nutrition. We obviously want to be careful about the amounts that we're consuming because they can also be high in calories. Avocados is another great source, but again, still high in fat, so we want to limit it. And then, of course, omega-3s are our fatty fish, so our halibut, trout, tuna, mackerel, salmon, herring, and sardines. So this is one thing, again, I try to highlight. So if there's a few things, this might be one of the ones I want to, like a strong takeaway. There are numerous research, and they just keep getting stronger and stronger about the protective benefits of omega-3 in the diet. So if you are somebody who will not eat fish, I understand that. Okay, we're not going to get all up in arms. Talk to your doctor about incorporating an omega-3 supplement. They're available, they're over the counter. And for those people who may have trouble with the fish ones, they also do make a vegan one from algae. I know fish burps seem to be some common concern that I hear from people, but the algae ones have been shown to be a little bit easier to tolerate from that standpoint. Also, things like adding flax seeds and chia seeds, walnuts and soybeans are also a great way to get the omega-3 into your diet. So I always encourage people to have 3.5 to around 4 ounces. So that's kind of, if you go to the fishmonger or wherever you're getting your fish, that's usually how they would sell these fillets. Try to eat that at least twice weekly. And again, when we're just talking about protein, because we were a little bit about some of the fats and things like that, you can get them in both animal and plant sources. And again, we're going to dive a little bit deeper into the plant sources in a little bit. But if you are choosing animal sources, I want to make sure that you're choosing those leaner or lower cuts of meat, or you're choosing less fat. So if you're choosing a hamburger meat, that you're choosing a 90-10, again, depending, or maybe you're going to do some meat, some white meat turkey. So there's ways to kind of cut around it, because I know the flavor is in the fat, but there's certainly ways that we can kind of incorporate both. And then again, we're going to want to try to avoid our processed meats, because those are high in nitrates and sodium and things like that. And as far as cooking methods, we do want to make sure that we're choosing healthier cooking methods. And I probably should add one here about the air fryer, the hot topic that everyone is talking about. But grilling, broiling, roasting, or baking, again, these ways we're cutting back on the fat. We're using the natural fat that's already found in the product if we're using an animal product, and then we're not adding extra fats to our cooking. Just need a little water, which is a perfect segue as I talk about whole grains, which is a fiber. And if we don't have water in our diet, our fiber is not going to work with us. So when we do think about whole grains, we do want to make sure that we're choosing 100% whole grains. Barley, oats, millet, bulgur, quinoa, oatmeal. There are so many different varieties out there. And I always like to caution everybody, just because something is brown and it looks like, oh, it has some words on it of wheat or something like that, it does not mean that it's healthy. It also does not mean that it's actually a whole grain. So the way that we're going to do that, and I'm going to come back, is I like to show this. This is just a Thomas English muffin. I took a picture of this and I uploaded it. Here's just the back of a nutrition label. And so I just want to point out, if we look at the yellow section, that's where we would find the ingredients. And so the number one thing I try to teach all of my patients is to be in charge of the foods that you're eating. So know what's going into your body. So in this case, I want the first ingredient in any of the carbohydrates that I'm choosing to be a whole wheat flour, because if it just says wheat flour, again, it's missing some of those nutrients and fiber that we're looking for. It's not bad, but the better option for you is to choose the whole wheat flour. And then another good trick is to look under the carbohydrate. You will see dietary fiber. In this case, it's showing 3 grams. Typically, I try to say, like, for a slice of bread, anywhere between 2 to 3 grams is a good choice for that. But again, the higher the fiber, the better. I also will caution people, there are a lot of products out there that are, I think, what's one I was just talking about with the patient, the 647 bread. I don't know if people are familiar with that. And a lot of those products have added fiber from other things, inulin and things like that. I just caution people that they can be very harsh on the stomach. So sometimes, I always say, if you think about how food should be and then how we've changed it as humans, a slice of bread should have around 3 grams. Anything more than that might be difficult in terms of the fiber that we're able to incorporate. There are some breads that have a little bit more fiber, but if you think about a slice of bread having 13 grams of fiber in it, that's a lot of fiber for somebody to digest in one thing. And so again, our goal is we obviously want to make sure that we're getting more fiber, but I want to be careful and caution people the way in which you're doing it, because sometimes too much fiber at once can be a challenge for people, and that's when people start complaining of GI discomfort or bloating. And then the other thing is, depending on the type of fiber, that might cause some people to have discomfort. So I had mentioned in here, we want to aim for 25 to 30 grams of fiber a day. And if we go, I don't think it was in my original slide, but if we think about how much fiber we actually are getting, if you remember, I said 80% of us aren't even meeting our patterns because they're low in vegetables and fruits and things like that. And that's mostly our fiber intake. And so the truth is, most of us are eating around 10 to 12 grams of fiber if we're lucky on a good day. And the recommendation is 25 to 30. Now, I would not recommend that anyone goes from 10 to 25 in a day. Not going to work. You're going to experience a lot of GI discomfort and it's not going to feel good. Instead, you're going to want to gradually increase your fiber slowly. Great way to do this is start adding a cup of quinoa or a cup of lentils to your diet. Work with that, get your body adjusted to that. Maybe the next week you focus on adding blueberries and some chia seeds. So again, you're slowly integrating it, so it's giving your body that new way to digest it. The other thing is, once you're adding fiber into your diet, the most important thing, and I said it was a good segue, is making sure you're having enough fluid in your diet as well. Fiber is like a sponge, and if you do not have enough water in your diet, it's actually going to be more binding. So we want to make sure that we have adequate fluids in our diet to support the increase in fiber. So we have 2 types of fiber. We have the soluble and the insoluble. And I don't know if people are on TikTok or if they're on Instagram or where people are getting their information, but this new trend that's out there is called fiber maxing. I didn't know about this. I'm off all of those social medias because I just They're too overwhelming, but I was reading an article that my colleague actually wrote, and she was talking about fiber maxing and how it's this new trend. And basically, people are shoving spinach into their mouth while they're cooking and doing things. So, again, as far as trends that are out there, I guess this is one that is exciting from the nutrition community because we've been talking about this for a long time. I guess I just didn't have as clever of a term. I would just say fiber is fabulous, but I guess fiber maxing is a lot hotter of a term, and it's sticking. So if this is something that you're seeing, that's kind of what it's talking about, and incorporating more fiber, again, something that we've been pushing for a really long time. So I mentioned that there's two different types of fiber, just to go over a little bit. The soluble fiber, that's the kind that's going to help lower cholesterol. It helps with lowering inflammation, and it's going to slow the absorption of sugar. So that's why if we're incorporating this, it's going to help keep our blood sugars more normal. And so examples are oats, peas, beans, apples, carrots, barley, and psyllium. The list goes on and on. I just wanted to provide a few. And then we also have our insoluble fiber. That's where we're talking about our gut fiber and making sure that we're having healthy bowel movements daily, and that we're moving things through our digestive tract. And so again, things like that are going to be our whole grain products, seeds, nuts, legumes, broccoli, cabbage, and you can keep reading there. And so again, this is another natural segue for me, because when we think about fiber, our major source is going to be our fruits and vegetables, but also our whole grains. And so again, we talked about this. More than 80% of people aren't meeting their basic needs of fruits and vegetables. So fruits and vegetables are an excellent way for us to make sure that we're getting all of those key vitamins and minerals that are important for good health. It's what I talk about daily. And again, they're naturally low in fat and calories, and they're filling. That's the whole point. They're going to fill you up in a very low volume. And again, they're high in antioxidants, and to help fight off that inflammation, making sure that we're keeping inflammation low in our bodies, that we're keeping our joints healthy, that we're giving our body the nutrients that it needs to help support bone health and build that bone the way that it needs to. So there is a large amount of research that has been coming out now about plant-based diets in OA. And so I want to just give a little caveat here about plant-based diets. A plant-based diet is a broad term that focuses on whole, minimally processed plant foods. So I like to tell people I eat a plant-based diet. That is not to say that I don't eat animal products, but I like to focus on the vegetables. I like to focus on legumes. I like to focus on beans. I'm focusing on the whole grains. That's the predominant part of my diet. I may have a piece of chicken, but that's not where I'm starting. I'm starting with all of the other stuff. So again, it doesn't necessarily need to exclude the way that when we think about a vegan diet is excluding all animal products. A plant-based diet is a more liberal term that is not excluding. It may, for some people, mean that, and that's okay, but it may also just be limiting or reducing the amount of the animal products and processed foods. So there is a lot of studies coming out there. And again, it makes sense to me as far as what I do. I always tell people I went into this because I love food, not because I hate food, and I want to help people eat and choose the right foods and eat them in the right way. So I just kind of wanted, because I know it can be scary to people, what does a plant-based diet look like? Here's an example. So we're going to do a cup of oats. And instead of using cow's milk, we're going to use soy, oat, flax milk. Any of these milks, I'm hesitant about saying an almond milk because there's not really that much protein in it, but it is a fine option as well. Or getting maybe a fortified almond milk. And again, even with these milks, I typically like to say make sure that they're fortified with calcium as well. Adding in a tablespoon of ground flax. Again, we're talking about fiber. We're talking about our omegas. We're hitting all of those nutrients. Adding in your berries. And adding in your walnuts. So we got omegas. So again, even just in breakfast, think about how much we're really focusing such a good diet variety, and we're reducing inflammation. Amazing. Snack, maybe an apple and peanut butter, or carrots and hummus. For lunch, a salad with lentils and quinoa. Add whatever vegetables that interest you. A little vinaigrette. And then again, I put here option to add chicken or fish, because again, if you don't want to do no animals, again, a plant-based diet does not have to mean vegan. It may for you, but people also may choose to follow a plant-based diet and eat a very limited amount of fish, and that's fine too. Or meat, whatever it is. Again, for a snack, having a handful of nuts or a cup of popcorn. And then dinner, a sweet potato with a black bean chili, or doing a tofu scramble. So there's a lot of ways. And again, or add cheese, or add that little bit of animal product, whether it's an egg. But again, your predominant focus is on the vegetables and the whole grains and the other things, because that's where the nutrients lie. So again, when we think about the plant-based diet and OA, the reason why it's so great is it's high in antioxidants, it's high in fiber, it's packed with all of those nutrients. It's going to help us feel full so that we're not overeating. It has all of those anti-inflammatory foods that we're looking for. It's also going to help with our improved gut health because it has all of those different fiber types. And so some of the clinical trials have shown that people who with OA pain, they experience reduced pain when they go to a vegan or a plant-based diet. Again, they're small studies and larger studies are needed to investigate that, but I think that this is an area of research that we're going to start seeing a lot more of. I'm going to quickly go through these, but this is just, I really just included this just to kind of show you. I know sometimes we all get stuck in a rut with our vegetables and fruit, but look how many different types there are out there. As far as sodium, again, the American diet is packed with sodium, and most of us are consuming more sodium than we really need. So we really just want to try to limit it. I tell people take the salt off the table. When you're thinking about your vegetables, buy fresh. Frozen is a great, or if you need to, do the canned, but make sure that there's no salt added. And then I always encourage people, if you're doing the canned, to kind of rinse it. And again, we're already limiting our cured, processed beef and things like that. As far as weight management, and this is another interesting area that's really up and coming with osteoarthritis. When we think about our weight, any extra weight that we have on our body is extra weight on our joints. And this was something new that I had heard, but when I first started working at HSS, but I had to relook at it to hear it again because it was so interesting. But every 1 pound that you lose actually takes 4 pounds of pressure off the knees and walking. So if you think about it, if you were to lose 10 pounds, which I know seems like a lot, but I think it's an achievable number for people to reach with a healthy changes in their diet. That's 40 pounds off of your knees. That's a significant amount. And that's why the studies are showing that even with 5%, not even 10%, just 5% weight loss can really reduce your symptoms. And so again, it's not just about changing your diet, but also the movement. And I say movement instead of physical activity because I'm very mindful about that. Movement looks like whatever it needs to look like for you. If it's sitting in your chair and doing some arm exercises or doing some seated cardio, that's movement. But I think the idea that we have of putting pressure on physical activity and cardio and things like that can be very overwhelming if that's not the state that you're in. So I like to just think of it as movement of your body. So again, when we think about weight loss, again, we don't want to see significant weight loss too quickly because that's never going to be long-term. It's usually 1 to 2 pounds a week. And again, don't make too many changes at once. Try to pick 1 or 2 things to focus on. And then the next few weeks, try to focus on something else. As far as curbing cravings, just to help maintain that healthy weight, being properly hydrated is a huge thing. I know you see people now carrying around those giant water bottles. Well, again, one of the number one things that we often mistake hunger for is thirst. Should I say that? Yeah, thirst. Thirst can often be mistaken for hunger. I said that backwards. So we often confuse that. So again, before you go and grab a big meal, have a glass of water, have something, seltzer water, whatever it is, just to make sure that you're actually hydrated. I know I'm guilty of it. I will have the water on my desk. I got the fancy water bottle. I did all the things I was supposed to, but I'm too busy talking. So sometimes I really have to set a timer, 5 minutes, drink the water or whatever it is to make sure that I actually get it down. So as far as what can I eat, I was so nervous about time, but now I realize that we're doing okay. So I'm going to hopefully slow down my speaking just a little bit. What can I eat? This is the exciting part. I was speaking to a chef before I came here and I said, I'm a dietitian at the hospital. And he goes, oh, I know what that means. You're going to start listing all the things that I can't eat. And I said, no, actually, I became a dietitian because I love food and I want to help people realize how much food they can eat. Because when you start hearing all the no's, no, you can't eat this, you can't eat that, it feels really intimidating. It feels really scary. And I know that's not what I would want to hear. Yes, we don't want to eat unlimited things, but we can certainly include foods in the right way into our diet. And that's the more natural way to think about it, because otherwise we're just going to, I always tell people when we hear no, what's going to happen? The natural response is, and I know this because I'm human, It's not going to be, yeah, okay. They said, no, I'm not going to do that. Some people are like that. And those people, great. I respect it. But typically the answer is, oh, you said no? Well, watch what I'm going to do. I'm going to eat so much of this cake. I'm going to eat so many of these cookies. But again, there's no shame with that. So when we take away the shame from food and like, don't do that, it becomes a lot more open and there's a lot more less stigma around it. And I think people are a little bit more successful with their choices. So I always tell people, eat more real whole foods. Again, predominantly try to avoid the package. Not to say, trust me, I use packaged things in my house. Sometimes you just got to get the job done. I'm not anti that. I'm not eating a steamed broccoli and a sweet potato all the time. So I sometimes use help with some of these things that we need. But in general, the goal is to eat more real whole foods. And when again, if you are choosing a packaged food, look for things that have real ingredients. This is what I was saying to the chef. I said Haagen-Dazs, and again, I don't own stock in Haagen-Dazs or anything like that. But when you look at the labels, it includes real ingredients. There are things that I can pronounce: eggs, cream, milk, sugar. These are things that if I were to make ice cream at home, I would put in. When you start thinking about 72 ingredients in ice cream, guar gum and this, those are in there because they're making it last longer. They're preservatives. Again, sometimes we need things to help stay on the shelves. But as far as, do I have to be the one to buy it? No, if I know that there's another option, I can certainly do that. So I always say, look for labels with pronounceable ingredients. I guess I forgot to include it in this one, but I typically like to include the jar of peanut butter because it's one of my favorite slides. What should be in peanut butter? Peanuts. It's my favorite question to ask kids. What should be in peanut butter? And they say peanuts. Why, of course. But if some of you have looked at your peanut butter jar recently, guess what? The answer isn't always peanuts. It's a whole list of things. So either I tell people get the fresh ground peanut butter, or one that I use is Smucker's Natural. Again, I'm not touting a product. I'm just telling you ones that I know that are out there that I've looked at the labels to make it easier for you. And it's not insanely expensive because I'm not somebody who's buying $11.99 peanut butter. And again, if you want to, by all means, that's just not how I approach this. But look for things that you can read. And again, some things, rice, what should be in rice? Rice, barley, so look for things that you know should be in the ingredient. Anything that there's in there, there might be things that I don't always know, but I try to say, okay, here's another one. Which one would be the better option for me? So what should my plate look like? And again, this is an example, and I'm showing you the chicken or the fish in this case, but it doesn't have to. Again, these are just plates that I took pictures of. It doesn't have to look like this. Again, if you choose to include the animal protein, that's fine. But remember that quickly, that piece of chicken can be changed with some beans. Same thing with the salmon. That could be some lentils with the brown rice and that, and could be equally as filling with a nice sauce on top or whatever it is. So again, you don't need the animal protein. So I just want to be very clear about that. And I guess I now next time need to make sure that I'm also including one of the other slides that I was talking about. So I apologize for not having it there. But again, fill your plate with the veggies. Hopefully in the next year I can give this talk, and instead of saying more than 80% of people have are not meeting their vegetable and fruit, maybe I can say 60% because 20% of you are going to make that change. And there's so many of you on this talk, and we're going to dent into that diagram, and I'll be so happy that I did my job. And then of course, change those whole grains, try something new, add it in. And again, just to be a little bit specific, and the reason why, again, I don't like to go into the nitty gritty so much always, because I think sometimes people focus on the nitty gritty. They go in there with their sheet and they say, check this, check this, check this. But again, if we are eating a real diet with real foods and we're hitting variety and we're getting different textures, it becomes easy and fun that we're hitting those check boxes without needing to think about it. So again, we talked about omega-3s. We talked about calcium and vitamin D. Vitamin C is really important for collagen formation. And again, we're going to find that in our vegetables and our fruit. Peppers are an excellent source of vitamin C. Cantaloupe has a great source of it. It's not just, and again, citrus fruits is the popular one, but you can find it in other ways as well. And again, antioxidants. Again, more fruits and vegetables. Guys, it's no brainer. If everybody here started eating more fruits and vegetables, again, I cannot wait to give this talk and see that number shift. And all of those bars are going to go to the top because everybody here, I think we have over 400 people here. All of you guys, hopefully after tonight, are going to be so excited about doing this that we're going to make a change. So again, fruits and vegetables, get at least 4.5 cups. Start saying to yourself, oh my gosh, how much am I really eating? I know most people are eating more fruits than veggies. Challenge yourself to up your veggies as well. Fruit, I always tell people, great option, but it's still sugar. So we just want to be mindful. It's not bad, but again, our goal is not to sit down and eat 7 cups of watermelon. But there is a reason why most of us cannot eat 7 cups of watermelon. I always tell people, you don't see a kale eating contest. You don't see a broccoli eating contest. Why? It would be over very quickly. Most people can't eat more than a certain amount. Why? Because it's filled with fiber. It's filled with nutrients. It's filled with all of those things. There is a reason why our brain stops us from eating it. There is a reason why our brain doesn't stop us from eating those other foods. The answer is because those foods typically lack nutrition. And so we have to keep eating more and more of those things because it's not sending the signal to our brains that we're full. So again, fiber, 25 to 30. Let's get that 10 grams up to 25 to 30. Remember, do it slowly. I don't want anybody getting a stomach ache on this call. I know I want to get that number up, and I want to get that number below 80% and change it. And I want to get all over 400 of you to increase your vegetable intake. But please, let's do it slowly so nobody has stomach aches and they're not calling me. Sodium, again, limit your sodium intake. Processed meats, let's try to get rid of it. I think hopefully after this, you can start seeing about different legumes and beans and seeds and see they are filling. There's a reason that fiber is going to fill you up. Again, don't try to do it all at once. Just see what it feels like. Maybe you do a bean salad and you still have a piece of chicken. Be liberal with it. That's why I like the term plant-based, because it's not as strict, but there's really great studies out there that are getting us there to show us the more that we're including in this, the more likely that people are to have less health problems. So again, fat, we talked about that. We're going to limit our high fat and our saturated fat. And again, water, I tell people aim for 8 to 10 tall glasses a day. Again, I am so guilty of this sometimes, so I don't want you guys to think that I'm above this. I sometimes am at 3 glasses and I come home and I'm so thirsty. Do you know what it means when you're thirsty? It means that you've passed the point and your body is sending, thank you, Claudia, for taking a sip. It means that your body is sending signals and it's telling you that it needs more of those things. I think this is my last slide. I know you guys have done a great job listening to me, and so I want to give time to listen to you and your questions as well. As far as some of the popular supplements that we've seen, glucosamine and chondroitin is a really popular one. Sometimes they're done separate, sometimes they're done together. And so these are natural substances that are found in cartilage. And so the thought with them is, like, because we know that they're naturally found in cartilage, they should naturally repair the cartilage and reduce inflammation. And so I'm here to tell you that the studies out there are small and the studies out there are mixed. Some studies show modest pain relief, and it's typically not done immediately. The studies that I've looked at typically see a longer term relief, like you have to really do it for 3 to 6 months, if not longer. And then again, there's also a lot of studies out there that find no significant benefit compared to placebo. My point of view is this: if I have patients who are doing things that I know are not harming them, I'm not going to necessarily fuss with it too much. But again, talking to your doctor, your pharmacist, to make sure that it's not interfering with maybe some other medications that you are taking, not necessarily maybe related to your osteoarthritis, but maybe some other conditions that you have, because we wouldn't want that to be a problem. And again, I always just like to caution people, supplements are not regulated like medications. So maybe you're taking one that says that it has the amount on it, maybe you're not. We really do not know. And so again, with that, I always like to tell people, always consult a healthcare provider. There should never be an example. Oftentimes, I always ask people questions when I see them. I say, and now are there any medicines, herbs, supplements that you're taking that wouldn't be listed in the chart? And it's not because I think people are hiding it, but sometimes I think people think that these things don't count, or if they're taking a calcium pill, they don't count. They absolutely count, and your doctor is interested in what they are, and they should be included in your medical chart. And remember, again, even if you are doing this, it's not a replacement for all of the other lifestyle changes that we've talked about, making changes to your diet. So it's with anything. One thing, there is no fix. And I kind of started off by saying this: there is no magic pill. There is no magic answer. I promise you, if that was the case, I would call each of you personally. I'm not looking to keep any secrets. In fact, I shared all of the secrets that I know. But again, there is no magic fix to this. It's making changes to support life every day and being able to maintain them. And again, that's why I like to have a very positive outlook when it comes to food, because we all get into that habit, that mentality of, oh, well, I've done this. Oh, one more day and I'll start tomorrow. Oh, I'll start this. But again, if we get rid of that shame with food and how we're thinking about it, we don't feel that, oh, tomorrow's, oh, okay, I'll start tomorrow, because it just feels, okay, I did this, I feel okay about it, and tomorrow I'll make a different choice, and it will be something that I can easily get back to.
There are a variety of questions about anti-inflammatory diets, anti-inflammatory foods. So I'm going to kind of pair a couple together. Are there any foods that make symptoms of osteoarthritis worse? And can you speak to the nightshade veggies at all? People say that they hear mixed reviews about nightshades and inflammation.
So it's really funny because I had a slide about nightshades and then I took it out because I wasn't really sure, because it's usually associated more with rheumatoid arthritis. But you know what? So there are, again, the nightshade studies, they're inconclusive, but I always tell people this. So again, especially because as I mentioned in the beginning, public health is one thing, and then there's individualized nutrition. So yes, if nightshades bother you, by all means take them out. So if you are never going to eat eggplant again, by the way, I might be one of those people because it just upsets my stomach. Okay, because there are so many other vegetables out there that you can eat. Where we start getting, especially as the dietitian, where I start to get a little bit more, and I think I kind of saw something along the lines in this in one of the questions, is when people tell you to eliminate whole food groups. So dairy, for example, it's one thing to take dairy out of your diet. And again, same thing. There are studies that are showing that there's inflammation, but there are also plenty of studies out there that are showing that there is no signs of inflammation, pending you don't have a problem with dairy and things like that. But again, if you want to take out dairy, that's fine. You need to find a way to get calcium into your diet, which is perfectly something that you are able to do. But that means you have to work that much harder to make sure that you're doing that, whether it's talking with your doctor or working with a professional dietitian, working with somebody to make sure that you can replace that nutrient. So again, if nightshade vegetables are bothering you, again, the studies are inconclusive, but again, your results for you, that's conclusive enough for me for you to say, I don't want to eat tomatoes or eggplant again. If it's going to bother you, by all means, take it out. But again, I care a little bit more when we're taking out something bigger, where it means that we're not going to get the nutrients specifically that we need. So thank you for that question, and I'll make sure to include it next time.
Thanks, Laura. There are quite a few questions about fiber as well, so we're going to just take a few of those. Is there a recommended split between soluble and insoluble fiber? Does it matter?
I tell people just get the fiber, don't focus on that. And again, I don't really like to give people numbers so much always, because then people are sitting there calculating and this and that. I think with anything, if you're going to start making a change, start by adding a little bit more fiber, but there is no difference between the two in the sense that there are many overlaps in the foods. And so as long as you're getting a different variety of fruits, vegetables, whole grains, legumes, beans, you'll hit that target really nicely.
Is taking too much psyllium husk dangerous?
I typically, so psyllium husk is one of those things, again, with anything is dangerous in large amounts. We never want to do anything in large amounts. Some people do not tolerate psyllium husk as well as compared to some of the other fibers that are out there. For example, citrusel sometimes is a little bit easier to tolerate. But again, too much of anything is never what we want. I cannot stress that enough. So yes, taking psyllium husk in large amounts can actually cause more constipation and problems, especially if you do not have enough fluid in your diet.
Great, that's helpful to know. And another, two more on fiber. Can you recommend an online resource for the amounts of fiber, or how do people tell what the amount of fiber is in a certain food that they're eating?
It's a great question. There's a lot of great websites out there that are from trusted websites. The Academy of Nutrition and Dietetics is a great place to start, and they have a lot of articles. The Arthritis Foundation also publishes a lot of things and works closely with dietitians, so that's another great place to look. I always tell people, like, the American Heart Association is another great place. So there's a lot of credible resources out there. Even HSS has a plethora of information for you to go to. So just making sure that you're getting it from a credible source is super important, because there's a lot of people out there telling you different things. So I think sticking to a credible, reputable resource is the best way to go. And I can include some links to Claudia later for her to include in the Q&A section of some great specific ones for osteoarthritis that do a great job with different handouts and things like that.
That would be great. Thank you. Okay, we have some other questions, and I think in the last couple minutes, it might be fun to do a little like a little rapid fire on some very specific questions. And so we have some food specific questions here. So does wine and liquor have a major effect on arthritis?
Wine and liquor, again, have a major effect on everything. So typically, again, everything in moderation, speak to your doctor about it. But again, certain things we don't want to do in excess. And I always caution people when we're drinking, we typically don't make the best food choices either. So something to keep in mind. And also interference with medications as well. I'm trying to go rapid fire now.
What about MCT oil?
MCT oil, as far as what specifically?
Is it beneficial for
osteoarthritis? I haven't seen any specific studies linked to MCT oil and osteoarthritis. If that's an oil that you are choosing to do, by all means.
Amazing. What category does tofu fall?
Tofu would be an excellent source of protein, and a great way if you want to include protein on a plant-based diet.
Is there any evidence that spelt wheat is healthier than modern wheat?
Than modern wheat?
Yes, modern wheat.
Well, I guess that there are some studies that are now looking at people who can't tolerate wheat in the United States, but they can tolerate them in other areas of travel. So I'm wondering if that's kind of what the person is kind of targeting at, that we have unfortunately manufactured things quite a bit in the American diet. And so oftentimes people may follow a gluten-free diet in America, and then when they go over to Europe or Asia or wherever they're going, they find that they can tolerate those things fine.
Amazing. And there's one question too, and I think it's important to hit this home. Someone's wondering what fiber has to do with osteoarthritis. And so could you kind of give that another go?
Yeah, sure. Absolutely. We'll make sure that we include this in the Q&A. So as far as there's now research that is coming out that fiber, it's included, it has all of your antioxidants, it has so many gut health benefits. And so adding more fiber into your diet, it's reducing diabetes, it's reducing cardiovascular disease, and all of these things have increased risk of inflammation. And so by lowering your inflammation and by including more of those foods that we know help lower inflammation, that's also going to help us reduce our risk of osteoarthritis.
Amazing. And
did I do a good job about it? I may not have done a great job about answering that, but again, there are no large studies with fiber because people don't sign up for that. We don't have a drug company that's backing a fiber study. So again, I can tell you, if you think back to the people didn't have some of these diseases that existed, and the reason why is because they were eating real food in real amounts without all of this other stuff. So if we get back to the basics and think about it that way, that's why we want that. But I will make sure to include a lot more resources on fiber and why it's so important and the benefits of antioxidants and all that stuff with the next group that will come out with the Q&A section.
Incredible, Laura. And I know all of our clinicians and our dietitians love fiber at HSS and are always happy to talk about it. So it's really nice to see the highlight and so many excellent questions come in about it. It's really been such a pleasure